Ms Patten.
Thank you, Acting President. I'll rise to speak on the appropriation bill and in doing so respond to the budget as well. Now, probably unlike some of our previous speakers, we'll give credit where credit's due. I know I was chastised for the way I did my grading on the budget on budget day, and a number of teachers told me that the C+ that I gave the budget was possibly harsh. But if listening to the contributions today, I'd say that some people would say that was generous. But I think, you know, we've got a budget where we're still achieving our AAA credit rating, and most of the rating agencies have indicated that that credit rating is safe, despite a $5.2 billion hole in our state revenue. Also, you know, we have seen write-downs, which has meant new measures to protect state revenue, measures that obviously are not popular in this chamber, and certainly with my colleagues here like Mr Quilty, who would like to see no tax whatsoever for this state. I can see that he would not be happy with the government's decisions. But I do think that I respect the government's decision not to use the stamp duty write-down as an excuse to exculpate themselves from honouring those election commitments. Going to the Treasury briefing last week, it seems that we are. You know, we're growing, our growth is strong, and most of the figures are quite good. You know, I'm pleased to see Northern Metropolitan was mentioned in this budget. As a region that has so many safe seats, both sides of this House quite often ignore it, and I'll do touch on Dr Cummings happily mentioning Broadmeadows in my electorate, which yet again has missed out on some really basic and urgent upgrades to their station. But we have seen, I've certainly seen some new schools in my region, some much needed upgrades to some of our schools. We're going to see a new campus at the Fitzroy Gasworks. We're going to see a significant upgrade to some of my primary schools, Brunswick Northwest in particular. You know, I apologise to Mary Health. I did try and get a significant commitment for the Moreland Road facility, but $300,000 won't go a long way. But I will continue to campaign for North Metro. It is growing, and we need some significant investment. Children are bursting out of schools, and we're seeing a much-needed infrastructure. However, I also would note, and there has been, certainly I've had a number of constituents talk to me about finally seeing the level crossings come off Bell Street, which is one of the most significant. People are waiting 20 minutes on some of those crossings. So, yeah, you know, there are some good things in the budget, and I think, but as I say, satisfactory, could do better, but, you know, tracking along. And I think on that point, you know, we've raised, and I've raised in this place, other ways that we could help with the budget. You know, while I do call for money to be spent in my region, and I will passionately talk about that, and I will talk about other areas where I don't think that this government is investing enough, you know, how about we crack down on for-profit businesses that take advantage of charitable tax exemptions while not actually providing charitable works? Now, this was conservatively rated to bring in $55 million this was by the Parliamentary Budget Office, would bring $55 million to our bottom line. So I would encourage the government to be thinking outside the square and looking at other ways that we can ensure that we have got the money that we need to spend on the well-being of Victorians. I also looked at our modern criminal justice policy. Now, we looked at this and were suggesting new ways for this government to address some of their criminal justice expenditure. The Parliamentary Budget Office said that our budget, our policy, would save Victoria $216 million. Now, when you think that they are spending $1.8 billion to build extra beds, they're spending $20 billion on trying to reduce incarceration of women, which I certainly commend them in doing. But we are spending more and more on crime. We are building more and more hospitals. Our courts are bulging. That we are seeing them overworked. We are seeing more and more money being spent on our courts, where there are other ways to do this if we do try and think laterally. Now, one of the centrepieces of our policy around this was looking at Spain's Diagrama Youth Re-Education model. And this is a strong evidence-based policy proven to dramatically reduce reoffending by addressing the causes of children's offending behaviour. Now, that doesn't sound like rocket science. That sounds quite sensible. If we can reduce reoffending, we will not be spending as much. We will not have as many offenders. And Spain's been doing this for about 24 years. So 24 years ago, Spain had a youth detention system similar to Victoria's. Today in Spain, there is a 75% success rate of reintegrating youth offenders into society without further offending. We, on the other hand, are spending, as I say, billions on prisons, and there's no real measure to test that success. And I'll talk about this a little bit later, but I think our performance measures in the budget really need to be actually looking for outcomes, not, public servant strokes of a pen. Treating drugs as a health issue, not a criminal one, which we consistently hear both sides of this House talk about. We can't keep arresting our way out of the drug war, but we keep trying. If we were to adopt Portugal's model, where they do actually treat drug use as a health issue, not a criminal one, and drug use does not go through the criminal system. Drug use does not go through the courts. It goes through a largely civil system that costs a fraction of the court system. So I think we're rolling out millions of dollars on some of these services, but how are we measuring them? And are we really, is this government being ambitious? And I just take as an example of this, in Budget Paper 5, we look at perinatal mortality rates per 1,000 of babies of Aboriginal mothers using a 3-year average. So this is trying to reduce the mortality of babies from Aboriginal mothers. In 17-18, the mortality rate was 9, and we have set our performance target for this year at 11. So we're going up. We're actually not reducing it. There's some, I don't know. I mean, is it necessary that we have a performance measure on public hospitals being accredited? So we've got a performance measure that 100% of our public hospitals will be accredited. Really? I would expect that. I wouldn't expect that that needs a budget measure. Now, I think our greatest measurement should be future-proofing our state. To this end, I've got a parliamentary intern project that's looking at legislating for future population wellbeing, examining the construct and building the framework. And Ethan Katz, our intern, is doing some great work in this area. And it's to look at the importance of legislating for future population wellbeing. And maybe putting those measurements into something that SARC would look at. And I certainly note that New Zealand's budget has been what they would call a wellbeing budget, and they are measuring the well-being. They are measuring the successes of their budget, not measuring that they've just said what they were going to do, that what they said they're going to do actually achieve something. And I think this would be, this is something that I will continue to campaign for over this next term of government. But it might be that something like SARC could consider this mechanism and assess new legislation through that lens, not just for human rights but also for well-being. I think there's a bigger conversation about what we're spending on, does it really work? And the budget papers, while they budget our performance measurements, I don't think really give us any information on that. Future-proofing our state, of course, is going to be inextricably linked to climate emergency. Victorian infrastructure and industry must be audited with new extremes in mind and mitigation plans implemented. More than this, we must be addressing this existential threat of climate change. The forecasts are compelling and the scenarios are devastating. This is probably the most important question of our time, and certainly it is something that was raised with me during the state election and certainly during this most recent federal election. I'm pleased to see that the government has put $2 million for a climate change strategy, and I will watch with interest that, and I'm hopeful that in future budgets we are seeing what we are going to do around climate change. But to return to the specifics of the budget, homelessness, not mentioned in the performance measures. So we're not measuring reducing homelessness, even though I know that there were probably not a single one of us who has not received correspondence about homelessness. There's not a single one of us that has not talked about the importance of it. Certainly there's a very modest public housing investment. And I'll be interested to question how we're going to get 1,000 new properties out of $209 million, but I'm sure in our Committee of the Whole we'll be able to find out how they are building 1,000 houses for such a small amount of money. But we need, this sector is screaming out, and housing, as we know, is then linked to poor health and crime. So again, by not spending on housing, we're then having to spend extra on building prisons instead of homes and building more hospitals because these people we can't maintain their health. I think homelessness should be a measurement, and these are the sorts of things that we should be measuring in our budget. $1.8 billion into the prison system to include 1,600 new prison beds. Yet 20 million, so 1.8 billion to build new prison beds, 20 million for rehabilitation services to reduce the rate of offending. Now, again, this seems like a missed opportunity. We know that reducing reoffending is good for the system. We know that we have a 60% recidivism rate here. So if we could cut that, the savings to our justice system would be phenomenal. And again, wouldn't that be something we'd like to measure in the budget? So out of that money that we're spending, what do you expect to reduce the rates of recidivism? We're funding 1,600 prison beds and 58 treatment beds. 58. Now again, 2/3 of the prisoners that are locked up in Victoria have drug and alcohol issues. It very often will be that their drug use has led them to that prison door. And yet, rather than spending money on addressing rehabilitation and addressing drug use, we are building more prisons and we're building more beds. Again, this is with mental health and addiction services. This is where this is missed opportunity. This is where we're spending money on the ambulance at the bottom of the cliff and not the fence at the top. The government admits that they're not doing enough in the area of mental health, and certainly Victoria has been far behind other jurisdictions in its attention and expenditure on mental health. And this is not just this government, this has been the situation for a decade. Now, I welcome the investment in inpatient beds, the $10 million investment into the Hope Restart facility in Gippsland, the $8.5 million to support Aboriginal Victorians with severe and complex mental health needs. And we have got a mental health, we have got a Royal Commission, but we don't need it to tell us some of the urgent and immediate things we need to do to address the obvious shortfalls in the system. In the lead up to the budget, we looked at how an investment of $543 million could save the state $1.1 billion. So that's a $2 saving for every $1 spent. Now, this would involve a range of things, but largely early intervention. Additional mental health funding that would look at the serious wait times for mental health referrals, increased training for health professionals to identify and support people with early onset mental health, expand combined mental health and drug treatment services, and a new focus on trauma-informed practice. The Parliamentary Budget Office, as I say, costed this at about $543 million, but also noted that it would bring a savings of $1.1 billion. I'm pleased that the government has listened and we're seeing an expansion of the availability of the drug naloxone. We know this does save lives. And naloxone, hopefully, we will be getting some of the most easy to use nasal spray naloxone that will be out there. This saves lives. And in doing so, it saves money. We're expanding our needle exchange programs. I will hope to see that naloxone is actually given to prisoners on departure from prisons, particularly those with a drug history before they go in, because we know they are at one of the most at risk. We know that prisoners die at an alarming rate in the first 3 months of release from prison. So naloxone would go a long way there. Very pleased to see that the government is finally funding their commitment to increase the operating hours of the medically supervised injecting centre. This was something that we called on last year. It was something that I felt had been committed to last year, but we will see it, and this will be very welcome to the North Richmond community. It's not all that we need in that community. We need investment in a whole range of infrastructure in that area, not necessarily expensive, but infrastructure that brings that sense of community to North Richmond in a place that has been really facing at the coalface of the drug use in our community. And finally, I think with health, I'm pretty proud to see that the government has put a significant investment to end-of-life choices care and the implementation of the voluntary assisted dying laws. As well as that, we're seeing some great injections of money being put into palliative care. And I note that Palliative Care Australia recently brought out a report that looked at the effects of assisted dying laws on palliative care. And in every jurisdiction where assisted dying laws had been implemented, palliative care funding had expanded and access to palliative care had improved. So again, assisted dying is part of that toolbox, and I think adds to providing far greater choice for people at the end of their life. And I'm very pleased to see that that a lot of the investment into palliative care is going into our regional and rural areas, which is something that we found when we were looking at the end-of-life choices inquiry. So, in conclusion, I think despite much of the criticism, this is, it's not a bad budget. I think, there is better ways to spend, and I do think that prevention is a far more cost-effective way of using a budget and of investing, and I don't see enough of that, and I will continue to advocate for that. I will also continue to advocate for proper performance measures or proper measures on, is this achieving what we want to do? So, is spending $1.8 billion on prisons, does that reduce the crime? Does it reduce recidivism? Is spending $29 billion on different areas of mental health, is that reducing it? Is that reducing mental health? Is that improving our mental health rates? Is that improving our dreadful and tragic suicide rates? So I would like to see our budgets have greater well-being in its in how it judges the budget, and I think I would like to see us working towards different ways to judge the budget, because I don't think public servants' performance measures are adequate for that. But on that basis, I'll commend the bill.